loves, welcome back to my channel. My name is Erica. If you're new here, welcome to my channel. I do a little bit of everything on this channel, mostly nursing stuff at the moment. So if that's your jam and you want to win something cool today, then just keep on watching. Okay, so I'm gonna go ahead and get started. Thank you so much to PICMONIC for partnering up with me on this video. I can't tell you how nice it is to work with a company that wants nursing students and new nurses to thrive. I mean, it's just amazing to be able to work with a company that is really helping us get through nursing school, because we all know nursing school is hell on earth, for lack of a better word. So I am so happy to bring you this video. I am going to be talking a little bit about PICMONIC and what they offer, and also be doing a giveaway. So let's go ahead and jump right in. Okay, so the first thing I want to show you is the giveaway, because that's what you guys are here for, right? The free stuff, which I am so happy to share with you guys. It is this Critical Clinicals PICMONIC 20-sheet cheat sheet book. Look at it, like it's perfect. And when I open it, it's gonna be like, ah, angels are singing, because I wish I had this in nursing school. If you are not aware, I am a labor and delivery nurse. I actually am going to be a year working in like 6 days, which is crazy to think that I went from student nurse to now nurse. It's still very mind-boggling. Anyways, I love this book and I wish I had had it, because I'm a visual learner. If you are a visual learner and you have to see and hear, and you, I mean, like, I don't know, I like both. I need to write it down, I need to see it, I need to hear it, and then I need to repeat the process. And PICMONIC really has the best method of learning, for me anyways. If you can hear it and that's it, you got it, I'm so jealous. I don't. I need to see it, hear it, write it, and do it all over again. Anyways, this book, it's a 20 cheat sheet, and it's for nursing school, NCLEX studying, and new grads. Highly recommend this if you are studying for NCLEX. It is, I mean, I truly believe writing your own notes is the best notes, but to have this like on the go and be able to refer to it for those key elements of what NCLEX is going to ask you. NCLEX is going to ask you like these questions that, like ABGs, like you need to know those, insulins, you need to know those, and they are in this book. So I'm just going to flip through it really quick. A lot of the times, let's see, this is what I had a hard time with, you guys. Blood compatibility. Look at this. It tells you everything about blood compatibility and like who can be a donor and who can be the receiver. It's just amazing. And then you have blood administration, which I promise you guys are gonna actually do a lot of if you are in like acute care setting. Even as a labor nurse, we do blood transfusions, and you have all of that here. It's just great, like what to look for if there's a blood transfusion reaction. You have hypercalcemia and hypocalcemia. You have all the hypers and all the hypos right in this book, and it breaks it down with pictures. I love pictures. It just helps me remember things better. You have your antidotes. You know how many antidotes there are to remember? You have hypothyroidism and hyper. Your assessment, your diagnosis. Look, you guys, pictures. This is why I love PICMONIC, because the pictures help me remember key elements of the disorder or whatever I'm treating. Yeah, brittle nails. I mean, heat intolerance. I mean, it's so good. Endocrine system. Endocrine was kind of hard for me. You also have, I mean, you have everything in here. Let's see if they have a table of contents. I just flipped through it. They do. They have a table of contents. So you have your lab values. Like, look at all this. All this is included in this cheat sheet. And I really wish I had had this in nursing school. Oh, I can't tell you how I still use PICMONIC as a new nurse. Sorry, it's a little washed out. But yeah, it's test-taking strategies. Prioritization, which is huge on NCLEX. Huge. I can't tell you how many questions you're going to have on prioritization. You have your critical lab values that I promise you're going to need to memorize these, because, well, I mean, you don't need to memorize them, but for me, when I go into my patient's chart, the first thing I look at is their medical history and their lab values, and then I can pick out which lab values are not within normal limits, and having seen them repeatedly, now I know this is without normal limits, and I need to call the doctor now. Those type of lab values. I mean, more lab values, you guys. There's so much in here. I'm so excited. I'm sorry. Your fundamentals, infection control, your crystalloids, your head to toe assessments. Look at that. Highly recommend. Cardiovascular was hard for me too. You have right and left failure. You remember that? How you had to track the blood flow of the heart. You guys, this is priceless. I'm so excited to be able to give it to you guys. And thanks PICMONIC for sending it to me. Oh, you guys, heart rhythms. Yes, this is a need to know, especially if you are working in the med-surg area. Respiratory, I mean, we have everything in here. We also have OB. I'm going to show you OB because I am a labor nurse. I am an OB nurse. And a lot of people have a hard time with labor or like OB content. For me, it came really easy. But I love that they included it. So like veal chop. If you haven't heard about veal chop, I promise, I'm not going to promise, but I'm going to suggest that it might be on the NCLEX. I don't know. I use this still as a labor nurse because depending on the variable will tell me what's going on with baby and if interventions need to be had. APGARs, I do APGARs for every one of my deliveries, and you need to know what each point stands for. I just love it. I really love this book. It is valuable content, and I highly recommend. If you don't win this, if you're gonna do anything for PICMONIC, get this book. So PICMONIC, as you can see, everything's picture-based, right? You can use your app. I have my app on my phone, and I just go. Let me turn this down a little bit. It's too bright. Okay, there we go. So I have the app on my phone, and for anything that I need a refresher on as a new nurse, I go and I type it in the search bar, and it just, here, there you go. See, there's the app. It's so user-friendly and it's so cute. They have these videos that you just watch, and it tells you the meat and potatoes of the disorder or whatever you are watching. So let's take a look at, what do I want to show you guys? Let's do nitroglycerin. So I clicked on it. I'm gonna play the PICMONIC. And
remember nitroglycerin
you
by your
guys,
nitro glacier.
It's a cartoon for adults.
Works by decreasing preload, shown by the down arrow preload
It's
heart pump,
amazing.
which is stuck as it's being frozen by the nitro. Common indications for this medication include angina, shown by the angel with chest pain. With
You guys
angina,
get it?
the
Do you
patient
see
can have up to 3 doses.
how it uses like cartoons and stuff to make you remember key elements of a disorder or whatever you're learning? I love it. I love it. I love to, if in my perfect world, if I was back in nursing school, I would listen to my lecture, write notes on my lecture, right? And then I would go over all of my notes and then listen to the PICMONIC of whatever I was being taught for that lecture and add to my notes and play these little cute cartoons so that I can remember them, because I am a visual person. I love that PICMONIC has developed a study system that really works for people who need visual aids. I am that person. It was really, nursing school was hard for me, like so hard for me. I cannot tell you how many hours I have studied. And I'm a mom, I'm a wife. You know, I have priorities in my life. And if I had this, it would cut my studying time by at least 75%. I mean, I really like mind, and like this type of content really works well for me. And I know a lot of you guys are the same. I'm telling you, I'm so jealous to the people who just have to hear it once and they remember it. I'm not like that. Highly recommend. PICMONIC has given me a 20% off code for you guys if you want to go ahead and try their app for free. Feel free to do so. They have like a free section. Give it a try before you commit. If not, use the 20% off coupon. It's great. It really is. I'm telling you, I'm so mad that I didn't buy it while I was in nursing school, but I still use it as a new grad nurse at the present time. I can't tell you how many times I go into the med room and I look something up that I haven't heard of before. Like my patient had hepatitis C, and I hadn't had a patient who had hepatitis C, so I did a quick search and boom, I knew that it was contact precautions. Anyways, I hope you guys enjoy. All of the giveaway information will be down in the description box. Make sure you go and enter. I cannot wait to give this away to somebody because it is valuable. It is priceless. Anyways, I hope you guys enjoyed, and I'll see you in my next video.